kod 50% kaka achiel kuom yore mag kedo gi medruok e kwan jogo manigi tuono e pacho ka. Kalura kod jagoro mogore migawo mar thieth Laktar Uma Oluga, nengo mamalo mar thiedho tuo sukari en achiedh nade maduong' ma jotuo ni godo. Owacho ni migawo mar thieth tudore kod kembe maloso gige thiedho tuo sukari kod yedhe mondo odwok piny nengo mar thieth. Oluga bende omedo ni piny Kenya nigi jotuo sukari 800,000 ka jotuo 54% pok opim. Gino momiyo idwa dwok piny nengo thieth ni mar onyalo konyo ting'o malo kwan jogo mipimo ne tuono.
We are now revamping the policies that are there. We have the NCD strategic plan for the Ministry of Health, under which diabetes comes, and we are very keen to work on what we call access programs, and we are working on access programs across the board, but 4 things that are important for us. One is, among the non-communicable diseases, diabetes is key because of the cost of the medications. We want to reduce the cost of medications by around 50%, and we are working on an access program where the Ministry of Health will take lead in engaging with manufacturers of diabetic products and diabetic medicines, so that then we can make this across the private and the public sector a reduction in the cost.
We have community health promoters, and we are training them in terms of educating them with regards to non-communicable diseases. So they go out of their way to screen and then appropriately refer to the health facilities. Our mandate at Kenya Diabetes Study Group is to train these healthcare practitioners. Now, if we can be able to ensure the Kenyan is actually screened and diagnosed at the right time and then referred timely, we can reduce this economic burden.
Ogai madomo pacho ka Martha Koome geno ni biro sidho yanga apisi